Good afternoon, members of the press. Fellow Kenyans, on Sunday, the 15th of March 2020, the government received confirmation of 2 more cases of coronavirus in Kenya, which brought the number of those who are tested positive to 3. The first case of this deadly virus was reported in our country on March the 12th, 2020, which we promptly relayed information to the public through His Excellency President Uhuru Muigai Kenyatta. Today, we have received confirmation of another case of coronavirus following tests carried out to a patient in one of our private facilities. This now brings the number of confirmed cases of coronavirus in the country to 4. The latest case was confirmed today at our National Influenza Center laboratory. The patient is reported to have traveled from London, United Kingdom, on the 8th of March 2020, arriving in the country on the 9th of March. Tracing of persons who may have come into contact with the patient is ongoing. You will also recall that when we got confirmation of the first case on March the 12th, a total of 27 persons who had come to contact with the patient were traced, quarantined, and tested. It is 2 of those who had tested positive. Results of the 25 plus an additional 23 other persons who have been tested have all turned negative. All the 23 from Bagathi Hospital, we have cleared them to self-quarantine at home. So far, our laboratories at Kemri and National Influenza Center have tested a total of 111 cases since this pandemic struck our country. For the 2 additional coronavirus cases, a total of 36 contacts have been traced to us by our surveillance team, and we are monitoring them. As you are aware, on the 15th of March, His Excellency the President had directed a number of measures, including travel, ban from any country with any case of coronavirus was restricted. Only Kenyan citizens and any foreigners with valid residence permits will be allowed to come into the country, provided that they proceed on a self-quarantine or to a government-designated quarantine facility. May I also add at this point that when the Public Health Act has been invoked, quarantine is not a voluntary measure. It is a mandatory measure which can lead to a big fine and a jail sentence. This measure at the airport is going to be instituted further by making those traveling into the country to swear a legal document that they will comply with what they are supposed to do. As you are aware, all schools and higher learning institutions have been closed and continue, and the work and the process of students going home is continuing. We would like to thank the schools, we would like to thank the parents for their understanding, because nobody has complained and everybody has been extremely understanding. We have also asked the transport system, the matatus who are transporting children, to transport them in clean, sanitized circumstances when they are taking them from their schools to their homes. And we have asked the schools not to put kids in their totality into public system, but to organize with public transporters how to take children from their school to their homes and in sanitized and clean conditions. We are also happy that the cashless transactions that we have advocated are going on smoothly. The central bank has stepped into this matter. We are appealing for even more improved offers from the cashless transactors. We have urged our people, and we will continue to urge Kenyans, please stay away where people are congregating. May there be weddings, may there be funerals, may there be religious congregations, may there be nightclubs, may there be churches. Please, please, we appeal to you. When we have looked at the countries that have managed to contain the coronavirus, they are those who the citizens have taken upon themselves to take responsibility. It is those places where social distancing has been brought to bear, and it is countries that have made decisions like the ones we have made very quickly. And for us to succeed, we will need the cooperation of just about every other institution that we have mentioned. We have asked that wherever possible, those people in offices, those people who are working, should actually try and work at home. We recognize that essential services must go on and essential work must go on. But we have given the measures that should be taken wherever this is necessary. The sanitary measures that we have given, the hygiene measures we have given, the distancing, the social distancing we have given, all these measures will go a long way into assisting us contain this virus. For clarification, there has been a number of things since the executive order was given and since the measures that we have taken were given. There's, as can be expected, various issues that have come up. And for clarification, let me just state the following. That in order for us to mitigate loss being suffered by our economy, there is coronavirus. After coronavirus, there will still be Kenya and there will still be the world. And in order for us not to suffer extreme economic losses, we have considered and found ways of ensuring that cargo vessels, cargo aircrafts or ships can come into the country provided they are disinfected at the point of departure and the crew quarantined on arrival. Following discussions we have had with the Chinese authorities, including the Chinese ambassador in Kenya, for instance, we have come to see how, as they restart their factories, we are also able to start moving goods and services, goods, particularly goods, no people, just the goods from their areas. There are ships in high seas in Kenya, and we have advised KPA that we are not stopping the ships from coming in. Goods can continue to be brought in, but we will definitely have measures for quarantining any crew that might be on those ships. The second one is that, as you all realize, Kenya is the host of the second largest UN mission in the world. And therefore, in order for the UN headquarters in Kenya to continue operating, diplomats traveling to the UN and residents and the families of persons resident in Kenya. You remember we said that if you are a resident in Kenya or if you are a Kenyan, your children can come to you. So the issue has been for those residents who are not Kenyan, but they reside in Kenya, what about their children? And we have said their children can come in, provided they also take the measures that we have given to even the Kenyans they must quarantine. So UN staff, diplomats, we have said, yes, they can travel alongside the other Kenyans, but they must also follow the rules regarding quarantine. We continue, ladies and gentlemen, to emphasize to the members of the public to remain vigilant and appreciate that this is not a joke. This is not a rehearsal. This is the real McCoy. And nobody should imagine or take lightly the threat that faces our nation. We do not wish to send panic. We do not want to send fear amongst our people. But at the same time, let's be honest with each other. We have got 4 cases at the moment. It started with 1. We went to 3. Luckily, we are not spiking like very many other countries. We went to 4. But we can almost predict that going forward, we should prepare. We should prepare for hopefully what will be not too many more cases. The fortunate thing that we have at the moment is that those who have tested positive are healthy as can be in those circumstances, and are continuing to be looked after and without any outright dangerous signs from them. As this happens, we continue to ask the citizens to maintain basic respiratory hygiene and safe food practices. Please tell our people, keep on cleaning your hands. We have taken to not shaking hands, and we have adopted the Indian greeting of simply acknowledging each other. This is not an abuse against our culture. This is the reality of the day, ladies and gentlemen. So please, we are asking the media to continue passing this message forward and to educate our people and to highlight the seriousness of the situation, because we have been receiving information from people who think that we should take this lightly, who think that we are taking measures that are outwardly unnecessary. And I would like to assure you, nothing could be more necessary than the measures we are taking. We have asked that those areas, those social gatherings that are still going on in supermarkets, in eateries and so on, that you continue to observe the highest levels of cleanliness. Our people, our public health officers are on the prowl. At the slightest sign that an institution is not, a restaurant or otherwise, is not observing the highest levels that we expect in terms of sanitation, washing of hands, and so on, then we shall take further steps. But at the moment, we are encouraged by the cooperation that we are getting from everybody. We are also making a special appeal for members of the public to utilize the toll-free number 719. 719. I'm appealing to the media, particularly the print media. If you could have that 719 somewhere in front of your newspaper, or somewhere on the bottom of running at the bottom of your TV stations, it would help a lot. Because currently what is happening is that everybody is calling everybody. I cannot tell you how many people have called me personally to report a patient in Huruma, the other one in Mukurweini, the other one in elsewhere. So please, we have a toll-free number. Let's use it. Fellow Kenyans, I appeal, as His Excellency the President did the other day, for calm, vigilance, and care. Thank you all very much.